So we're opening back up, but COVID-19 is still here. So I want to give an update on what's going on in the literature and some information on how to keep yourself safe, because in the States, new cases are still going up in 21 states. If you're in Canada, things are much better. Numbers are going down. In parts in Africa, Nigeria, Egypt, Algeria, huge number of cases. So they're seeing their big surge. Pakistan seeing a lot of numbers. So international travel probably not happening anytime soon, but we are going to hope for the best. And I'm going to give you some information on COVID-19 literature data. So by now, we're all aware that Black Americans are being much more affected by COVID-19 than white Americans. And this is both due to inability to access proper medical care and racial discrimination in the medical field. However, even in Canada, we're finding that Black Canadians are disproportionately affected by COVID-19. This came as a surprise to me. As a country that has universal health care, you would think that people who have access to healthcare at all levels would not show this type of disproportionate effect. In fact, Canada didn't think it was actually even worth collecting data looking at the racial statistics of COVID-19, and they're still not widely doing it. However, some sociologists at the University of Western looked at the census data and the data of COVID-19 cases and found that in Montreal, that Black Americans were much more heavily affected. This is likely due to the higher immigrant population in Montreal, living in close quarters and living together, maybe not having access to healthcare yet, but it also shows that there is definitely some racial discrimination in Canada, and it's something that should be talked about. So what's going on with medications? A few days ago, we got a press release from a research study done in the UK. And I say press release because the study wasn't actually released yet. It was just a press release of preliminary results, which I think is kind of cool because, like, since when do we have press releases of journal articles? Anyway, this study in the UK showed that low-dose dexamethasone, so low-dose steroids, were shown to improve mortality for patients with COVID-19 who were ventilated and just requiring oxygen. This is huge. This is mind-blowing because at the beginning of this pandemic, we were thinking that steroids would actually be detrimental because it could decrease a patient's immunity and leave them more susceptible to bacterial infections. When patients are really sick in the ICU, like septic and requiring pressors, very ill, we give them high-dose steroids as part of the protocol to help bring them out of that high catecholamine state. But this is low-dose steroids. It's only 6 milligrams, and it actually showed to improve mortality for these patients. So remdesivir, we were kind of hoping like, oh, this antiviral might help us, but the studies with remdesivir only showed that it decreases hospital length stay. So I think it was from like 15 days or from 17 days down to about 15 days. So not huge, but when it came to mortality, there was no statistical difference. So that's really interesting news. In terms of hydroxychloroquine, study after study has showed that hydroxychloroquine is not helpful when it comes to COVID-19. At best, it is useless. At worst, it's harmful. So finally, the FDA said they revoked the emergency use of hydroxychloroquine for research trials and in the hospital setting. So that's good. The people who actually need that medication can hopefully get it and not have any issues requiring that medication. And now we can move on and find a better cure or treatment for COVID-19. All right, asymptomatic spread. We hear about it. It's like this big fearful demon. Asymptomatic spread, asymptomatic spread. Is it real? I don't believe it. It is real, okay? Asymptomatic spread, it's what's really getting COVID-19 on her legs and running and continuing to do her thing. So studies done in Annals of Internal Medicine looked at the major hotspots that we've had COVID-19 outbreaks. So like the Princess cruise ship in various nursing homes, especially in Seattle. And we're looking at those numbers based on this study. Asymptomatic spread is up to 40 to 45% of transmission. Some of those patients will go on to develop symptoms, usually 4 or so days after. However, a lot of them don't. So this is something to be cautious of. I think this is really shows that the only way that we're really going to get out of this so that we're not like crippled by this virus is having widespread testing and not just depending on temperature checks for screening, but doing testing in large scale testing so that we can actually use it to track the prevalence and also decrease the amount of transmission. So please wear a mask, okay? And that goes to my second or third or fourth, wherever we're at, update. Masks. So I'm out there and I'm seeing mask use, I want to say an average of 50%. So I saw a group of kids, there was like 7 of them, okay? 3 of them had masks, 3 of them didn't. One had a mask that was like just hanging out right here. So based on that population size, we're averaging just under 50% of people who are out there using masks. So that's not going to help us really avoid having a continuous surge or a second surge, as some people want to call it. You have to use a mask. There was a study that was done that did a kind of a mathematical analysis of mask use and the prevention of transmission. And this study showed that even if the mask was 50% effective, so that's like your worst cloth mask or compared to like an N95 mask, even the mask at 50% effective prevented transmission of virus and brought the level of transmission down to less than 1. And that means like when a patient or a person had COVID-19, the amount of people that they were spreading it to decreased significantly with masks. So please wear a mask. You want to go out there, you want to do your thing, but wear a mask. Prevent the transmission to other people and from you getting it. Antibodies. So there might be some hope of developing immunity after contracting COVID-19. Numerous studies have shown that patients are developing monoclonal neutralizing antibodies, usually B-cell antibodies, IgG type, which are the good antibodies that we would hope for lasting immunity. These are the antibodies against the spike proteins that surround the virus. So they help prevent the virus from entering the cell. Is this going to result in lasting immunity or long-lasting immunity, like memory helper B cells and T cells? We don't know yet. It's really too early to tell, but a study in Switzerland showed that 1 out of 10 patients developed these monoclonal neutralizing antibodies. They were less likely to develop them if they were children or if they were over the age of 65. So that's where we're at in terms of COVID-19. Please keep in mind our Black brothers and sisters in the US and in Canada who are experiencing this probably much differently from yourself. If you are out and about, please wear a mask. Just wear it. It doesn't hurt. I promise it's helpful. If you have had COVID-19, you may be immune, but you're probably not. We don't know. So act like you're not and just use all the precautions necessary, and like you never want to get the virus again. If you are out there navigating these newly open spaces, just make sure that you are using all the safety precautions that the organization or building has in place, and making sure that you're keeping yourself safe. And just make sure that, you are keeping in mind that asymptomatic spread is real and you could be in close contact with someone who has COVID. So stay safe, everyone. I hope this was helpful.